Welcome back, future nurses. Today we're diving into 50 reproductive health NCLEX questions that will challenge you, sharpen your critical thinking, and push you closer to success. Remember, every nurse who has passed the NCLEX once sat where you are now, uncertain, nervous, but determined. These questions are not just practice, they are your stepping stones. Each rationale and strategy will give you tools to approach the exam with confidence. Stick with me until the end, because your consistency, just like your compassion, will carry you through. You can pass, and this session will prove it. Question 1. A nurse is teaching a client in the first trimester of pregnancy about nutrition. Which food is the best source of folic acid? A. Milk. B. Spinach. C. Chicken breast. D. White rice. Answer: B. Spinach. Rationale: folic acid prevents neural tube defects like spina bifida and anencephaly. Green leafy vegetables and fortified cereals are primary sources. Chicken and milk are important for protein and calcium but don't meet the folate requirement. White rice has minimal folic acid and less fortified. Strategy: when NCLEX asks about folic acid, always think greens plus fortified grains. If neural tube defects prevention is mentioned, folate is the answer. Question 2. At 28 weeks, a pregnant woman presents with preeclampsia. Which finding is most concerning? A. BP 142/90. B. 2 plus proteinuria. C. 3 plus reflexes with clonus. D. Dependent edema. Answer: C. 3 plus reflexes with clonus. Rationale: while mild hypertension and proteinuria suggest preeclampsia, hyperreflexia with clonus is a danger sign of CNS irritability, indicating progression to eclampsia. Seizures are imminent without intervention. Strategy: on NCLEX, prioritize neurological symptoms in preeclampsia because they signal seizure risk life-threatening. Question 3. What is the purpose of RRB? A. Prevent infection in newborn. B. Protect maternal tissue. C. Prevent maternal antibody formation. D. Enhance fetal oxygenation. Answer: C. Prevent maternal antibody formation. Rationale: Rh-negative mothers exposed to Rh-positive fetal blood may form antibodies. RRB prevents this by destroying fetal Rh plus cells before sensitization occurs. Without it, subsequent pregnancies may develop hemolytic disease. Strategy: think, RRB equals prevention, not treatment. Question 4. A woman in active labor suddenly reports severe pain, cessation of contractions, and fetal bradycardia. What's the priority? A. Reassure the patient. B. Check cervical dilation. C. Prepare for emergency C-section. D. Apply oxygen. Answer: C. Prepare for emergency C-section. Rationale: these are classic signs of uterine rupture. This is a catastrophic obstetric emergency requiring immediate surgical intervention. Strategy: if NCLEX describes sudden pain plus fetal distress plus loss of contractions equals uterine rupture surgery. Question 5. A postpartum client's vitals, T 100.2 degree Fahrenheit, 37.9 degrees Celsius, BP 90/60 mmHg, HR 120 BPM, RR 20 per minute. Which is most concerning? A. Temperature. B. BP. C. HR. D. RR. Answer: C. HR 120 BPM. Rationale: tachycardia is an early sign of postpartum hemorrhage. Hypotension and fever may come later, but HR rise indicates hypovolemia. Strategy: always suspect hemorrhage first when tachycardia is present postpartum. Question 6. How should a pregnant client relieve leg cramps? A. Increase salt intake. B. Flex the foot dorsally. C. Massage the calf firmly. D. Apply heat packs. Answer: B. Flex the foot dorsally. Rationale: dorsiflexion stretches calf muscles and relieves cramping. Massage is avoided due to DVT risk. Heat packs are supportive but not corrective. Strategy: leg cramp relief equals dorsiflex foot, not massage. Question 7. A newborn has APGAR scores of 3 at 1 minute and 6 at 5 minutes. What's the priority? A. Begin chest compressions. B. Continue resuscitative measures. C. Place skin to skin with mother. D. Document findings. Answer: B. Continue resuscitative measures. Rationale: APGAR 7 requires oxygen, stimulation, or suctioning. Chest compressions are only if HR less than 60. Skin to skin is only when stable. Strategy: APGAR 7 equals continue resuscitation. Question 8. When is it safe for a postpartum woman to resume sexual intercourse? A. After 1 week. B. When breastfeeding ends. C. When lochia stops and healing occurs. D. After the first menstrual period. Answer: C. When lochia stops and healing occurs. Rationale: this is usually 4 to 6 weeks postpartum, once the uterus involutes and perineal tissues heal. Earlier activity risks infection and trauma. Strategy: always tie intercourse resumption to healing and absence of lochia. Question 9. A woman receiving magnesium sulfate for preeclampsia has RR of 10 per minute. What's the priority? A. Monitor closely. B. Stop the infusion immediately. C. Increase 4 fluids. D. Administer oxytocin. Answer: B. Stop the infusion immediately. Rationale: RR less than 12 is a sign of magnesium toxicity. Stop infusion and prepare to give calcium gluconate. Strategy: memorize MgSO4 toxicity triad, RR, reflexes, urine. Question 10. Teaching for gestational diabetes, which statement shows understanding? A. I only need to check blood sugar once a day. B. I may need insulin because oral meds are unsafe. C. I must avoid all carbohydrates. D. This will not affect my baby. Answer: B. I may need insulin because oral meds are unsafe. Rationale: oral hypoglycemics cross the placenta. Insulin is safe. Carbs are needed for fetal growth. Uncontrolled diabetes increases macrosomia, hypoglycemia, and birth trauma. Strategy: gestational diabetes equals insulin therapy, not oral meds. Question 11. A pregnant woman at 10 weeks reports morning nausea. What's the best advice? A. Eat large meals 3 times a day. B. Eat dry crackers before rising in the morning. C. Take antiemetic medication daily. D. Avoid all fluids in the morning. Answer: B. Eat dry crackers before rising in the morning. Rationale: small frequent meals and dry snacks reduce nausea. Avoiding fluids is not safe. Antiemetics are not first line in mild nausea. Strategy: Nclex loves crackers for nausea in pregnancy. Question 12. A nurse assesses a postpartum woman with boggy uterus and heavy lochia. First action? A. Call the provider. B. Begin oxytocin infusion. C. Massage the fundus firmly. D. Start 4 fluids. Answer: C. Massage the fundus firmly. Rationale: a boggy uterus indicates uterine atony hemorrhage. First action is fundal massage. If ineffective, then medications. Strategy: always massage first before meds for uterine atony. Question 13. A nurse cares for a client with ectopic pregnancy. Which finding is most concerning? A. Positive pregnancy test. B. Sharp abdominal pain and shoulder pain. C. Missed period. D. Vaginal spotting. Answer: B. Sharp abdominal pain and shoulder pain. Rationale: shoulder pain plus abdominal pain equals ruptured ectopic pregnancy with internal bleeding. This is a surgical emergency. Strategy: refer shoulder pain in pregnancy equals internal bleeding. Question 14. A client asks why oxytocin is given postpartum. Best response? A. To prevent infection. B. To increase milk production. C. To contract the uterus and prevent hemorrhage. D. To relieve pain. Answer: C. To contract the uterus and prevent hemorrhage. Rationale: oxytocin stimulates uterine contractions, compresses blood vessels, reduces postpartum bleeding. Strategy: oxytocin equals contract uterus, control bleeding. Question 15. The nurse is assessing a newborn with jaundice at 12 hours of life. Which interpretation is correct? A. Normal physiological jaundice. B. Pathological jaundice, requires immediate intervention. C. Normal finding, no action needed. D. Caused by dehydration only. Answer: B. Pathological jaundice. Rationale: jaundice within first 24 hours is always abnormal and may indicate hemolysis or infection. Requires urgent evaluation. Strategy: before 24 hours equals pathological. After 24 hours equals physiological. Question 16. Which sign suggests placenta previa rather than placental abruption? A. Painful vaginal bleeding. B. Rigid, tender uterus. C. Painless bright red bleeding. D. Abdominal pain with contractions. Answer: C. Painless bright red bleeding. Rationale: placenta previa presents with painless bleeding. Abruption presents with painful, dark bleeding and rigid uterus. Strategy: previas are painless, abruptions are painful. Question 17. Which position improves placental blood flow in a woman with preeclampsia? A. Supine. B. Semifowlers. C. Side-lying, left lateral. D. Prone. Answer: C. Side-lying, left lateral. Rationale: side-lying improves uteroplacental perfusion and reduces vena cava compression. Supine position worsens circulation. Strategy: left side equals best perfusion to placenta. Question 18. A nurse is teaching about Kegel exercises postpartum. Which statement shows correct understanding? A. They help prevent constipation. B. They strengthen pelvic muscles and bladder control. C. They reduce milk leakage. D. They prevent back pain. Answer: B. They strengthen pelvic muscles and bladder control. Rationale: Kegel exercises improve pelvic floor tone, reducing urinary incontinence and prolapse risk. Strategy: Kegels equals pelvic muscle tone, not digestion. Question 19. Which finding in a newborn requires immediate intervention? A. Acrocyanosis of hands and feet. B. Irregular respirations 30-60/min. C. Nasal flaring and grunting. D. Flexed extremities. Answer: C. Nasal flaring and grunting. Rationale: these are signs of respiratory distress. Acrocyanosis and irregular respirations are normal in first 24 hours. Strategy: grunting/flaring equals distress priority. Question 20. Which prenatal supplement prevents neural tube defects? A. Calcium. B. Iron. C. Folic acid. D. Vitamin D. Answer: C. Folic acid. Rationale: adequate folate prevents spina bifida and anencephaly. Should be taken before conception and early in pregnancy. Strategy: always link folic acid with neural tube. Question 21. Which maternal history increases risk for postpartum hemorrhage? A. Prima gravida, 39 weeks, labor 6 hours. B. Multiparity with twins, prolonged labor, oxytocin use. C. G1P0, elective C-section. D. Mother with history of mild anemia. Answer: B. Multiparity with twins, prolonged labor, oxytocin use. Rationale: multiple gestation, prolonged labor, and high oxytocin exposure stretch the uterine atony high hemorrhage risk. Prima gravidas and C-section have lower risk and less complications occur. Strategy: on NCLEX, look for uterine overdistension or prolonged stimulation as hemorrhage risk factors. Question 22. A woman in her third trimester reports sudden gush of clear fluid from the vagina. What should the nurse do first? A. Check fetal heart rate. B. Inspect perineum for bleeding. C. Ask when she last voided. D. Prepare for C-section. Answer: A. Check fetal heart rate. Rationale: suspected rupture of membranes, ROM. First action is to assess fetal well-being because cord prolapse and fetal distress are risks. Strategy: in obstetrics, always assess FHR first when membranes rupture. Question 23. Which newborn finding requires immediate intervention? A. Head circumference 33 centimeters. B. Blood glucose 35 mg per deciliter. C. Caput succedaneum. D. Positive rooting reflex. Answer: B. Blood glucose 35 mg per deciliter. Rationale: hypoglycemia, less than 40 mg per deciliter, can cause seizures and brain injury. Head size and caput are normal variations. Strategy: low sugar kills fast, intervene first. Question 24. A postpartum woman is experiencing engorgement. What is the best advice for breastfeeding? A. Avoid feeding until pain subsides. B. Apply warm compresses before feeding. C. Use tight bras to stop milk flow. D. Pump and discard all milk. Answer: B. Apply warm compresses before feeding. Rationale: warmth softens breast tissue, improves letdown reflex, and makes latching easier. Tight bras and discarding milk worsen engorgement. Strategy: warm before, cold after is the rule for breast engorgement. Question 25. Which finding is expected in a newborn of a mother with gestational diabetes? A. Low birth weight. B. Small head circumference. C. Hypoglycemia after birth. D. Dehydration. Answer: C. Hypoglycemia after birth. Rationale: maternal hyperglycemia leads to fetal hyperinsulinemia. After birth, glucose supply stops but insulin remains. Hypoglycemia. Strategy: think, big baby plus low sugar. Question 26. What is the nurse's priority when a laboring woman's umbilical cord is visible at the introitus? A. Place the woman supine with legs elevated. B. Apply oxygen and start 4 fluids. C. Push the presenting part off the cord with a gloved hand. D. Notify the provider immediately. Answer: C. Push the presenting part off the cord with a gloved hand. Rationale: cord prolapse causes fetal hypoxia. Manually relieving pressure preserves circulation until emergency C-section. Strategy: cord prolapse equals relieve pressure plus prep for surgery. Question 27. A client at 36 weeks reports itching of palms and soles without rash. What condition should the nurse suspect? A. Preeclampsia. B. Intrahepatic cholestasis of pregnancy. C. Gestational diabetes. D. Placental abruption. Answer: B. Intrahepatic cholestasis of pregnancy. Rationale: hormonal changes impair bile flow. Bile salts deposit in skin. Itching can increase risk of stillbirth. Strategy: pregnancy plus itchy palms/soles equals cholestasis. Question 28. Which instruction is most important for a woman taking oral contraceptives? A. Take with meals. B. Avoid alcohol. C. Stop smoking. D. Take at bedtime. Answer: C. Stop smoking. Rationale: smoking while on oral contraceptives increases risk of thromboembolism, stroke, and MI. Strategy: contraceptives plus smoking equals clots. Question 29. Which finding is normal in the lochia serosa stage? A. Bright red heavy flow. B. Pinkish brown discharge. C. Yellow-white creamy discharge. D. No discharge at all. Answer: B. Pinkish brown discharge. Rationale: lochia progression equals rubra, 1 to 3 days, red, serosa, 4 to 10 days, pink/brown, alba, 10 to 28 days, white. Strategy: memorize rubra serosa alba. Question 30. Which immunization is contraindicated in pregnancy? A. Influenza, inactivated. B. Tdap. C. MMR. D. Hepatitis B. Answer: C. MMR. Rationale: live vaccines, MMR, varicella, are contraindicated in pregnancy. Inactivated flu and Tdap are safe. Strategy: live equals no in pregnancy. Question 31. Which position is best during the second stage of labor? A. Supine. B. Lithotomy. C. Squatting. D. Prone. Answer: C. Squatting. Rationale: squatting widens pelvic outlet, facilitates descent, and shortens labor. Supine position reduces blood flow. Strategy: for pushing, gravity helps. Question 32. A client at 8 weeks gestation is taking isotretinoin for acne. What is the priority nursing action? A. Teach skincare techniques. B. Refer for nutritional counseling. C. Notify provider immediately. D. Administer prenatal vitamins. Answer: C. Notify provider immediately. Rationale: isotretinoin is highly teratogenic, causing severe birth defects. Must be discontinued. Strategy: teratogens, isotretinoin, warfarin, ACE inhibitors, equals immediate stop. Question 33. A woman in labor has meconium-stained amniotic fluid. The nurse should prepare for A. Immediate cesarean delivery. B. Suctioning the newborn's airway at birth. C. Oxygen via nasal cannula for mother. D. Administration of antibiotics. Answer: B. Suctioning the newborn's airway at birth. Rationale: meconium aspiration can cause severe respiratory distress. Suction reduces risk. Strategy: meconium equals suction airway. Question 34. Which nursing action is priority during oxytocin induction? A. Encourage oral fluids. B. Monitor fetal heart rate and uterine contractions. C. Provide perineal massage. D. Increase maternal activity. Answer: B. Monitor fetal heart rate and uterine contractions. Rationale: oxytocin can cause uterine hyperstimulation, fetal distress. Continuous monitoring required. Strategy: oxytocin equals watch FHR plus contractions closely. Question 35. A pregnant woman at 30 weeks reports sudden painless vaginal bleeding. What condition should the nurse suspect? A. Placenta previa. B. Placental abruption. C. Preterm labor. D. Ectopic pregnancy. Answer: A. Placenta previa. Rationale: classic sign equals painless bright red bleeding in second/third trimester. Abruption is painful. Strategy: previa equals painless. Abruption equals painful. Question 36. Which lab test confirms pregnancy? A. CBC. B. Urine ketones. C. Serum beta-HCG. D. Progesterone level. Answer: C. Serum beta-HCG. Rationale: HCG is produced only by trophoblast cells after implantation. Strategy: always pick HCG for pregnancy confirmation. Question 37. A nurse cares for a woman with hyperemesis gravidarum. What complication should be closely monitored? A. Hypocalcemia. B. Hypokalemia. C. Hypertension. D. Proteinuria. Answer: B. Hypokalemia. Rationale: severe vomiting leads to electrolyte loss, dehydration, weight loss, and ketonuria. Strategy: persistent vomiting, think potassium loss. Question 38. A laboring woman suddenly experiences shortness of breath, chest pain, and cyanosis. What should the nurse suspect? A. Pulmonary embolism. B. Amniotic fluid embolism. C. Placental abruption. D. Pneumonia. Answer: B. Amniotic fluid embolism. Rationale: rare but fatal complication where amniotic fluid enters maternal circulation. Presence with sudden cardiopulmonary collapse. Strategy: sudden respiratory collapse in labor/postpartum equals amniotic fluid embolism. Question 39. Which is a normal finding in a 2-day-old newborn? A. Jaundice. B. Respirations 80 per minute. C. Heart rate 60 per minute. D. Grunting. Answer: A. Jaundice. Rationale: physiologic jaundice after 24 hours is normal. Respirations greater than 60, HR less than 100, or grunting are abnormal. Strategy: jaundice after 24 hours equals normal, before 24 hours equals abnormal. Question 40. A nurse teaches a pregnant woman about iron supplements. Which statement is correct? A. I should take it with milk. B. It may cause constipation. C. It should be taken with antacids. D. I should avoid vitamin C. Answer: B. It may cause constipation. Rationale: iron causes constipation and black stools. Absorption improves with vitamin C, but is reduced by milk or antacids. Strategy: iron equals constipation, take with vitamin C, avoid milk. Question 41. Which finding indicates postpartum infection? A. Lochia rubra on day 2. B. Temperature 100.5 degree Fahrenheit, 38 degrees Celsius, on day 1. C. Foul-smelling lochia. D. Fundus firm in midline. Answer: C. Foul-smelling lochia. Rationale: indicates endometritis or infection. Normal lochia is odorless. Strategy: smelly lochia equals infection. Question 42. Which finding is associated with hydatidiform mole, molar pregnancy? A. Severe nausea, very high hCG levels. B. Low hCG levels and small uterus. C. Normal fetal heart sounds. D. Vaginal bleeding with fetal parts visible. Answer: A. Severe nausea, very high hCG levels. Rationale: abnormal trophoblast growth produces excessive hCG hyperemesis, absence of fetus, and risk for cancer. Strategy: mole equals high hCG, no baby. Question 43. Which reflex disappears last in newborns? A. Moro reflex. B. Rooting reflex. C. Palmar grasp. D. Babinski reflex. Answer: D. Babinski reflex. Rationale: Babinski reflex is normal up to 1 year. Other reflexes disappear earlier. Strategy: Babinski lingers longest. Question 44. Which teaching is correct for a woman using an IUD? A. It prevents STIs. B. Check for strings monthly. C. Replace yearly. D. Use with spermicides. Answer: B. Check for strings monthly. Rationale: ensures IUD hasn't been expelled. It does not prevent STIs and lasts 3 to 10 years depending on type. Strategy: IUD equals string check, not STI protection. Question 45. A newborn is placed under a radiant warmer. Which intervention prevents heat loss via conduction? A. Drying the infant quickly. B. Warming the mattress. C. Closing the doors and windows. D. Using a hat and blanket. Answer: B. Warming the mattress. Rationale: conduction is heat loss by direct contact with cold surfaces. Drying prevents evaporation, blankets prevent convection, closing doors prevents radiation. Strategy: conduction equals contact. Question 46. Which finding suggests HELLP syndrome? A. Hypertension, hypoglycemia, proteinuria. B. Hemolysis, elevated liver enzymes, low platelets. C. High WBC, fever, tachycardia. D. Hyperemesis, dehydration, ketonuria. Answer: B. Hemolysis, elevated liver enzymes, low platelets. Rationale: HELLP is a severe preeclampsia complication that can cause liver rupture and bleeding. Strategy: remember HELLP equals hemolysis, elevated LFTs, low platelets. Question 47. Which action prevents supine hypotension syndrome in late pregnancy? A. Place pillow under knees. B. Lie flat on back with head elevated. C. Position in left lateral recumbent. D. Use Fowler's position. Answer: C. Position in left lateral recumbent. Rationale: the gravid uterus compresses the vena cava when supine, reducing cardiac output. Left lateral prevents compression. Strategy, supine hypotension equals roll to left side. Question 48. Which sign is most reliable for confirming true labor? A. Back pain. B. Contractions relieved by walking. C. Progressive cervical dilation and effacement. D. Irregular contractions. Answer, C. Progressive cervical dilation and effacement. Rationale, only cervical change confirms true labor. Contractions alone are not definitive. Strategy, Nclex equals cervical change equals true labor. Question 49. A newborn is 3 hours old with HR 90 BPM. What's the nurse's priority? A. Stimulate the infant and reassess. B. Begin chest compressions. C. Administer oxygen and reassess. D. Document findings as normal. Answer, C. Administer oxygen and reassess. Rationale, normal newborn HR is between 110 to 160. HR 90 equals bradycardia, needs oxygen first. Chest compressions if less than 60. Strategy, HR less than 100 equals oxygen. HR less than 60 equals compressions. Question 50. A postpartum client asks about preventing pregnancy while breastfeeding. Best response? A. Breastfeeding fully protects you from pregnancy. B. Use a non-hormonal method like condoms or copper IUD. C. Start estrogen pills immediately. D. Avoid all contraception until your period returns. Answer, B. Use a non-hormonal method like condoms or copper IUD. Rationale, lactational amenorrhea is not reliable. Estrogen reduces milk supply. Non-hormonal methods are safest. Strategy, breastfeeding is not equal to birth control. Use barrier or IUD. And there you have it, 50 tough Nclex reproductive health questions with full rationales and strategies. Every single question you practice brings you one step closer to becoming an RN. Don't forget, mistakes are lessons, not failures. Tell me in the comments how many questions you got correct out of 50, I want to see your progress. Keep practicing, keep believing, and keep showing up for yourself. Because the truth is, you can pass. I believe in you, and soon you'll be the next Nclex success story.